I'm Lindsay Coatsbush. I'm one of the diabetes specialist nurses here at CCICP. Diabetes is linked with pelvic floor disorder by about 50 to 70%, and this is due to many causes, including obesity. And we all know that with type 2 diabetes, that's one of the main symptoms of type 2 diabetes, with increased weight, insulin resistance. So obviously this may have an effect on the actual bladder wall itself. It stretches the bladder wall, and obviously that can lead then to urinary incontinence, and also risk of infections, thrush. One of the complications of diabetes is neuropathy. It's not just neuropathy in the limbs, hands, where you'd expect them to be, but you can also have neuropathy in the bladder and also in the gut. So some people will come to you with problems with incontinence, urinary and fecal incontinence, and this could be certain medications, but it could also be a sign that they've got nerve damage within the bladder or the bowel. And with the nerve damage, they might not be able to feel their bladder filling or feel whether it is full or not. So the bladder can keep filling and filling and filling and stretching that bladder. So if that happens, they may not feel when it's emptied as well. So if it's not emptied properly, then you've got remnants left, which can then again increase the risk of infection. But issues with that is obviously it's getting that elasticity back within that bladder, and that's very, very difficult to do. So obviously pelvic floor exercises are really, really important in that aspect. With regards to the bowel, again, symptoms of frequency of loose stools, not noticing that you've actually passed any stools is a really, really big issue for patients. It actually takes a massive part out of their life. They can't go out anymore. They're frightened about where they're going just in case they have an accident. So obviously this is really, really important to identify. Good HbA1c control will help to improve and reduce these risk factors. We know that with a HbA1c increase of 1%, it can increase your risk of urinary incontinence by 34%. So obviously it's a big number. It's really important to ensure that you manage this to keep your HbA1c within a desired target, to help to reduce the risk factors and complications, including the neuropathy in the bladder and the bowel. Some of the things you can do to improve this is looking at dietary intake, looking at your day-to-day meal planning, looking at carbohydrate awareness. Carbohydrates are really important within your day-to-day meals, but again, it's all about portion control, having a healthy balance, having healthy options wherever possible. To do this will help to not only help to improve HbA1c, but it will also help to reduce weight. Other things you can do are increasing activity. Activity, I say more than exercise, because some people can't do exercise because of other issues with their health, mobility. So it's that increased activity, either upper activity, or just doing some easy, gentle exercises, and that will help to reduce the weight factor and also help to reduce the HbA1c. Obviously medications are important with diabetes, and you will see your healthcare professionals when you're required to have your annual reviews and updates, and there is a step up on medications that you may need to go on, and it's nothing to do with what you're doing in particular, it's just the progression of the diabetes itself. Just to be aware as well that some of the medications can also have an effect on your bladder and bowel, so if you do have any unwanted side effect symptoms, then make sure you do speak to the healthcare professional, because it may be that these medications are causing some irritation, and obviously if these are not helping, then we maybe need to look at an alternative. Don't just stop them and keep silent. It's important to make sure that you get these things looked at and addressed.